And good morning and welcome to this Community Initiated Solutions information session for the upcoming funding opportunity from the Colorado Health Foundation. My name is Ageno OT, and I am a portfolio director here at CHF. Before we get started, I just want to give a couple of housekeeping items. So we are recording this session so that we can post it onto our website for many others to be able to watch. So we will only publish images of Colorado Health Foundation staff and our interpreters for today. But if you feel more comfortable, please go ahead now and shut off your camera. We will have time after the brief presentation at the beginning for questions, and you can come back on camera if you feel comfortable then. But I want to give people the option now to turn off their cameras if they feel more comfortable. But again, we will only be publishing images of CHF staff and interpreters on our website. Since we are recording this session for publication, please remain muted until the presentation is over. That will be about the first 10-15 minutes. And we'll inform you when the recording stops and when you can bring your cameras back on and continue with the question and answer portion. So by attending today, you are not only going to get basic information about community-initiated solutions, you're also going to have an opportunity to ask questions that will be helpful to the whole group. And we'll do that after we finish the brief presentation at the beginning. As you just heard, and if you're just joining, we have Spanish and American Sign Language interpretation available today. So please use the globe at the bottom of your Zoom menu to select the language of your heart. If you have any questions or need some assistance throughout, please use the chat to send a chat to CU or Liz Carpio, or CU Tran or Liz Carpio, who can assist you throughout this program. So again, my name is Ageno, and we will begin. Next slide, please. So community, I'm not going to talk much about the Colorado Health Foundation, but I'm happy to answer questions when we get into the question and answer period. But want us to spend some time really talking about the community-initiated solutions funding opportunity that is available for our June 15th deadline. So we have several different priorities that we work through here at the Colorado Health Foundation, and one of them is called Community Solutions. Community Solutions is focused on supporting local ideas that address health challenges and have demonstrated community will behind them. So this work is about uplifting the power of a community's culture, of a community's creativity, to develop community-driven solutions that promote health. On this image on the slide, you see 4 different ways to be in relationship and partnership to solve social issues. The work of Community Solutions really focuses on the bottom half, on the last 2 images, the bottom images of this, those 4 images. So for Community Solutions, we prioritize work that is happening by and for communities themselves. So what we mean by this is we prioritize groups who are working to address health inequities, and the solutions are created by the community members who are living through the health inequity themselves. It means that they are leading the work, they are deciding on what happens. In some cases, we also support and will use donate or give funding towards groups who are in deep partnership with communities and working with community members who are experiencing the health inequity. I'll talk more about this in just a minute, but want to give you all an overview of what we mean by community-led work. Next slide. Another way to think about community-led work is with this visualization. So if you move all the way on my screen, it's all the way at the right end of the screen, the blue image that shows arrows going in multiple directions. And those arrows are to represent people. And so you see those arrows going in multiple directions because the relationships are happening in all different ways. And that means that there is equal power and equal access and decision-making amongst all the people who are engaged in the work, but particularly the people who are living through whatever the health challenge is, who are experiencing the health challenge. So looking at this empower image, the blue image all the way at the right end of the screen, again, those relationships with the community are with each other in all directions. And so when we talk about community-led change, we mean that the decisions are made and the solutions are implemented by the community members themselves, who again are living through that health challenge. So next, I'm going to talk with you all about some of the basic criteria that we use to kind of decide what constitutes a grant that might get approved for community-initiated solutions. We want to go to the next slide. Community-based groups and nonprofits, and at this time, we're really talking about community groups or community-based organizations, including those that are without 501c3 nonprofit status, as long as they're partnering with the fiscal sponsor, or they can also be nonprofit partners as well. That those are the types of organizations that we are talking about funding, whether you have 501c3 status or are using a fiscal sponsor. But any of those organizations who apply, we are talking about applicants that can demonstrate a large commitment to community identified and community led efforts. With this funding opportunity, we're really looking to find community members who are directly impacted by health inequity, and the organizations are using their support to strengthen the solutions that community comes up with through the partnership. Community members can work with an organization or they can do the work themselves. It's really up to the community themselves to decide that. But for us, we're really focused on community members identifying the health issues that they want to tackle, taking the lead and designing the solutions, and moving forward and actually acting upon those solutions. Next slide. And so I'll talk through a couple of different pieces with regards to this work, but know that in the long run, we are really focused on supporting communities to address a specific health challenge. We want communities who are living through inequities to develop and implement solutions towards addressing those health challenges. We are looking for community members to leverage the strengths and resources that they already know about. So if you are living through a health challenge, your understanding about the solutions and the needs are very intimate because you were living through it. And so this is an opportunity to tap into that creativity. And at the end of all of this, we are really hoping that this is a strategy to help move even deeper towards health equity by engaging very deeply the communities who are most impacted themselves. Next slide. So I'm going to walk through some of the different criteria that we use and how we understand whether a application may be qualified for community-initiated solutions or not. And we talk about a few different key areas, and I'll go through each of them, but they're listed here on this slide, and each of them are the population identified, the issue or challenge, the evolution or the origin of where the work came from, that the work be action-oriented and be focused on an action, the participation of a community, and then finally, the leadership of community members. And so again, I'm going to go through each one by one. Next slide. So when it comes to population and issue or challenge, with regards to population, we want applications to name very clearly who is involved, who and what is your relationship to the population that is experiencing the health challenge. So we have to be able to say this is the health issue, and this is a specific population that is impacted by it, and this is the relationship to people who are experiencing that health challenge. So if you are an organization who is working with community members who are experiencing a health inequity, what is your relationship to that community member? If community members or community group, if your group is comprised of people who are experiencing that health challenge, you need to name that in your application. We at the Colorado Health Foundation use a very expansive definition of health. For us, health doesn't just mean things that happen at a hospital or at a clinic. They also include things that include average day living, things that help you to succeed in life. So they can include everything from how you're connected to other people, how you are able to reach success in life, the ways in which you think about your relationship to power and society around you. So we use this broad definition of health and know that when we're talking about population, we, have our cornerstones at the Colorado Health Foundation, which help us to understand health within the context of power, privilege, and income. And we want the applications to benefit persons who have historically had less power, privilege, and income. And so for us, that means persons who are living on low income, persons of color, and persons with lived experience of the named health inequity. So be clear about the population that is impacted and the relationship of the organization or the group to the population that's impacted by whichever health inequity that is named. The issue or challenge, so the health challenge needs to be identified. You have to clearly state this is the health challenge that we are addressing and how it's being explored by people with lived or living experience of the challenge. The solution that is proposed should be addressing a health challenge with a clear naming of how that health challenge gets in the way of health equity. It should be specific to a community. Maybe that community is by geographic region. Maybe that community is by income or some other identification marker. You have, and really thinking about, when you're talking about the issue or the challenge, how can we impact that issue or challenge, however it is happening locally here amongst our community? While the solution may have broad application to many members of the society or many areas, we really kind of specifically focus on addressing challenges of a particular focus so that your interventions can be effective. So for example, if you are addressing maternal health, just as an example, maternal health overall impacts lots of people differently. But if we look at data or if we look at what it means in a specific area, to name a specific county and a subgroup population that is impacted or maybe even most impacted by mental health further brings out how the health inequity is being experienced within your locality. Next slide. So the origin or the evolution of the work and action orientation. So when we talk about community-initiated solutions, the two words community-initiated are very important. What we mean by community-initiated is that it came from the community members who are living through the health inequity themselves. And so for the origin or evolution of the work, we need you to verify the history of how the community has come together to identify the issues. So using that same example of maternal health, how have birthing individuals come together to say, these are the challenges that we experience in birthing. These are the ways in which we might address some of those challenges. And here's how we've decided to come together and put our actions towards something that might improve conditions for us and hopefully other people. So the origin of the work has to come from the people themselves who are experiencing the health inequity. When we talk about action orientation, what we mean here is that this is not just about talking about a problem or exploring the problem solely. We mean that the solutions have to have practical steps to address the issue. So we've got to have some action going on there. And it's okay to try things that maybe you're unsure about, but there has to be action forward on trying to address the challenge with some types of solutions. Next slide. Community participation and leadership. This is probably the area in which most applicants fall short when they are applying to the Colorado Health Foundation. So by community participation, I've kind of said this over and over, and that should be a hint to you, is that to support folks with living or lived experience of the named health inequity, that they have a meaningful way to be involved and be involved in a number of ways. They need to be involved in the identification of the problem. They need to be the ones who are beginning to explore all of the ways in which the problem might be showing up in their lives and in the community. They need to be the ones who begin to brainstorm the solutions or the ideas around what to do about the problem. They are involved in the planning and the development of these solutions, as well as they stay involved over time. So even if a group of community members, let's go back to that same example of maternal health, even if a group of birthing individuals comes together and says and names two solutions that they want to implement, and one of those solutions involves a large institution, and another one of those solutions involves them working with each other. How they engage with a large institution remains in their purview, in their power, and their decision-making over the time. And so, again, the participation of the community remains at a high level throughout the work. And finally, for the leadership piece, so not only do key leaders who are experiencing the health inequity and living through the health inequity have key leadership in implementing and deciding the work, our preference is actually to support groups and funding towards grants that have leadership that is held by persons with lived and living experience. Again, partners can be a part of the work, but we expect for the roles to be clear, that there is clear marcation of who is doing what, and that the discretion of leadership be the default to persons with lived and living experience. Ultimately, for partners who are working to support community leadership, their purpose is to uplift the leadership of impacted community. Next slide, please. So I know I've gone through this pretty quickly, but I want to make sure that we have time to open up for questions and answers. But before we do that, just a couple of key pieces of information. So the grant deadline for community-initiated solutions is on June 15th, 2025. This funding opportunity is only available once every single year. And so the next opportunity to apply for this would be in 2026. The best way to find out about whether your organization or the idea or the group that you are working with qualifies for or might be in a good running to get community-initiated solutions funding is to contact us. And so you can contact us a number of ways. You can reach us at 303-953-3600. You can also email us at funding@coloradohealth.org. If you go to our website, you will find under the funding tab, you will find lots of funding opportunities that are open for June 15th. If you are reaching out to us to talk specifically about any funding opportunity, but particularly for community-initiated solutions, please go to the website first to read through the funding opportunity before you have the conversation with a program officer. When you have the conversation with the program officer and you have read what's available on the website, you will be able to have a more detailed conversation about what your work looks like and the applicability to community-initiated solutions. Okay, next slide. So we have gone over kind of all of the basics of community-initiated solutions. We'll end our recording.